Hello, my name's Ian Penman. I'm a consultant gastroenterologist. I work at the Royal Infirmary of Edinburgh in the UK. I trained in medicine at the University of Glasgow. I did my medical training there, and I did my gastroenterology training here in Edinburgh and a fellowship in the USA. I've been a consultant gastroenterologist here in Edinburgh for 25 years. I have a broad interest in luminogastroenterology and special interests in the endoscopic management of esophageal disease, especially Barrett's, and of advanced and interventional endoscopy. But my job involves the day-to-day assessment of patients with a broad range of gut disorders. It is highly respected, highly regarded as a single volume, high quality and up-to-date medical textbook, and it was a privilege to be asked to be involved in it as a chapter author. And it's a real responsibility as an editor to make sure that you carry this legacy forward and continue to produce a book that not only that we're proud of, that Elsevier are proud of, that medical students and junior doctors love reading and learn hugely from, but one that something that's always at the forefront of my mind is, or the back of my mind is, would Sir Stanley Davidson approve of this? And I have to say, that weighs heavily on the editors when we're producing the book. And I think he would. I think this 70th anniversary, 24th edition is really contemporary, really up to date, really fresh. And I think he would, I think I'm fairly confident he would be very pleased to receive a copy of it. The vision for the 24th edition, which coincides with the 70th anniversary of the book, originally produced by Professor Sir Stanley Davidson, the vision was to continue that legacy, to continue to produce a single volume medical textbook that was comprehensive but readable and accessible, balanced, clinically appropriate and relevant, that is well curated, beautifully illustrated, and gives medical students and junior doctors an insight and a level of knowledge that they can get what they need in a comprehensive way in a single volume, and to be fresh and up to date. Large textbooks such as Davidsons, with many different chapters, we need a structure, and that structure you could envisage it in several different ways. The one that we settled on is to split the book into 3 sections. The first section really deals with fundamentals and core principles of medical practice. So as well as chapters on good medical practice, decision making, prescribing, we have chapters on the fundamentals of inflammation and immunology, infection, genetics, pharmacology, and so forth, that really underpin what comes next in the book. The second section really groups together the emergency presentations, so the acute and emergency management of the critically ill patients, so intensive care. We have chapters on toxicology, envenomation, medicine in austere environments where there are often emergencies, and also the emerging specialty of acute emergency medicine, covering the most common presentations across medical specialties. And so we put them together, and then comes the largest section of the book, the third section, which deals with the major specialties, the major organ-based specialties, a much more taxonomic approach to medicine, dermatology, rheumatology, cardiology, liver disease, etc. And that is how we feel the book can be set out, so students and readers can go to whichever section they need to get the information they want. For this 24th edition, every chapter has been revised and fully updated up to 2021. In addition, everybody out there is aware we've been hit by the SARS-CoV-2 COVID-19 pandemic the last couple of years. We have introduced a whole new section on COVID within the infectious diseases chapter. That is quite comprehensive. As you know, we're in the middle of this pandemic. There's a lot of uncertainties, and our evidence base around COVID is changing almost by the week. And yet we have tried to keep this as fresh as possible right up to the point of the book going to the printers. We have completely rewritten the oncology chapter to reflect modern advances in systemic anti-cancer therapy, new biologic agents, checkpoint inhibitors and immunotherapy. We've radically revised rheumatology and dermatology and other chapters where biologic therapies are evolving at a rapid pace to reflect these disease-modifying agents. We've added in new sections to biochemistry. We've radically rewritten the nutrition chapter, recognizing that not just undernutrition, which remains a major problem in the world, but overnutrition, obesity, really threatens human health. So we've rewritten all of these. All the other chapters have had a major upgrade as well. Reading a textbook is one thing, but knowing how you're getting on and how you're assimilating that knowledge and how to apply that knowledge to a clinical scenario is one measure of progress. Multiple choice questions are a good way of assessing what people have learned and their problem-solving skills and providing feedback. And we produced a companion book of over 1,000 MCQs to go with the 23rd edition, which not only provides case-based clinical multiple choice questions with explanatory answers, but it then references back to the relevant page and chapter in the book, so students can go straight back and learn more. And for this 24th edition, we wanted to update that by producing an additional bank of MCQs as an extra way to allow readers to understand for themselves how they're getting on and to help prepare for medical student and general medical postgraduate exams. We try to ensure that the book is pitched at the right level for medical students and newly qualified doctors and generalists in a number of ways. It is, and that is in a sense, the art of editing and curation. And curation's a big thing. We live in a world now where we can have all the information we want at our fingertips. Sometimes we drown in information and we don't know how reliable, we don't know the provenance of the information we get. We don't know what is really reliable and trustworthy. And one of the jobs of the editors is to curate all of that, to produce a book that is balanced for the needs of medical students and junior doctors. To try and help that along, we have a large UK and international advisory board drawn from, I think, 11 different countries, including Europe, the Middle East, Africa, and Asia. And we rely on them critiquing the chapters, giving us feedback, telling us what they think needs more emphasis or anything that we need to update or improve or add in. We also commission surveys of the book by medical students in the UK and internationally before each edition. So we get feedback. And we listen to that feedback and try and incorporate it into future editions of the book. So how best to use the book is a difficult question, and I don't think there is a single correct answer. Different medical students, different human beings learn in different ways. Some people will want to open it at page 1 and just work methodically all the way through it. And I've seen in trips to medical schools here in the UK, and especially when I've been on trips to medical schools in India, I've seen that students do that. I think the majority of students will need to and want to go in and out of the book. And I think the book is there to complement your lectures and tutorials. It's there to complement other learning resources, such as lectures and bedside teaching. I think one of the best ways to use the book is that when clinical students are on the ward or in clinic and they're being taught about a given condition or a given presenting problem, they should then go away and read around the background of it by getting into the book, finding what they need to cement that learning that they had. So just reading books gives us superficial learning that isn't often deeply embedded and remembered years down the line. But if you apply a clinical situation, something you saw, something that just happened to you, an interesting case on the ward, for example, and then go away and read about it, often that learning is deep learning and stays for much longer. And I think that's one of the best ways to use the book. Why should medical students use Davidsons when there is so much information out there? I think we always have the potential to find whatever we want on the internet, searching. There are great resources out there online. There are great journals, but actually the fundamentals of medical practice don't change. They are about really good history taking, good examination technique, working up a diagnostic problem list, selecting the right investigations, understanding the differential diagnoses, and then initiating management. And having all of that in one resource, a resource that you can trust, because it comes with a 70-year 24 edition legacy, because it is a national and internationally authored book, not just a single author book. I think that gives it provenance, it gives it curation, and it gives it governance, that this is information you can trust and rely on. I think absolutely that the rigor that we put into producing the book, the tradition, the legacy, the fact that it is constantly upgraded, renewed and refreshed, that it has a wide authorship drawn from many countries, all of whom are experts in their own right, and the legacy of all of that means that this is an information resource that students can trust, and that it is balanced. There is knowledge there, but it's not just a textbook with lists of facts and tables. It describes carefully how to assess patients with their presenting problems, what the key clinical features are, how to examine the patients, how to select investigations. We use a lot of algorithms and flow charts, mannequins and composite tables and drawings to try and help students go from learning a list to actually becoming astute physicians.